Welcome everyone. I'm Noria Uedo from Osaka International Cancer Institute, Japan. Today, I'm joined by Renata Nobre from São Paulo Cancer Institute, Brazil, and we will be discussing the importance of endoscopy evaluation of the oral cavity and pharynx. Renata, could you start by explaining why this topic is so crucial?
Thank you, Edo Sensei, for giving me the opportunity of joining you on this conversation. Well, first of all, pharyngeal cancer is an important cause of death worldwide. And unfortunately, most of the patients are diagnosed when already at an advanced stage. And also, the incidence of head and neck cancers appears to be increasing not only in Asia, but also in Europe and America. So we need to improve our ability to detect this cancer at an early stage.
Certainly, in Japan, there is a strong emphasis on screening program for early detection of cancers, including esophagus, stomach, and the pharynx. Japanese endoscopy has been for a long time adopting advanced technique for precise diagnosis and treatment. Do you think this can also be done in Western countries?
Absolutely, Uedo Sensei. As you know, in Japan, patients with high risk to develop primary squamous cell carcinoma on the neck and head, and also on the esophagus, are systematically screened. And what I could see after I experienced at Osaka International Cancer Institute is that the detection rate of superficial head and neck cancers are remarkable. And also, I could see that you not only detect, but also you treat these lesions by endoscopic resection. So after return to Brazil and armed with this knowledge and this inspiration, I began implementing the endoscopic screening of pharyngeal cancer on the patient at São Paulo Cancer Institute, ECESP. And I could see that the initial results were amazing. And so I realized that yes, we can adopt this practice in my reality. It is feasible, but we need to increase the awareness of the endoscopist about this.
Indeed. What do you think about the strategy of the endoscope evaluation of oral cavity and pharynx?
So I think the technique developed by your team is very simple and easy to do and requires only a small mouthpiece and then takes less than 2 minutes. So I think it's reproductive and it's not difficult to do.
That's fascinating. In Japan, endoscopy has expertise in performing endoscopy diagnosis and resection because the technique was developed here. Most of endoscopy have expertise in performing these procedures. Western countries may not have adopted this practice as widely. And what do you think we could do to change this reality?
Thank you, Edo Sensei, for highlight this. I think the most important strategy is to share knowledge. And after discussing with you about this topic, we arrived at a crucial conclusion. We need to increase the awareness of Western endoscopies regarding the importance of pharyngeal and oral cavity evaluation. So it's why we decided to write this provocative article. And by doing this, we are aiming to spread the knowledge so that the future endoscopies all over the world can be capable of diagnose pharyngeal cancers at an early stage and can thus improve the outcomes. We know that the journey to reproduce the success of Japan's technique in the Western countries requires effort. And so, to begin with, we need to promote educational programs and teaching mainly when and how to do this.
That makes sense. The importance of sharing knowledge cannot be overstated. Early detection can significantly increase the chance of successful treatment and improved outcome for the patient. By doing this, we can make a positive impact on the world.
Thank you, Edo Sensei, for your commitment of spread your knowledge all of the world. And I truly hope our article will make difference on the future of endoscopy and also make an important role on the improvement of the patient care. Thank you very much.